Hello everybody, my name is Algirdas Puišys. I am a periodontologist from Vilnius, Lithuania, and now having more than 20 years experience in dental implantology field, I'm looking all the time for how to improve my daily work. What to use, what materials to use, what techniques to use to have better healing, better solutions for my patients. And it was also an interesting story by implementing some CBD products into dental field. Honestly to say, I was very skeptic for a long period of time using some herbal products, but generally speaking, today we have too much antibiotics used in our daily life. And according to World Health Organization, this resistance of bacteria is rising dramatically, and in future it may cause really big problems. So somehow we just get known some biotechnologists, people who were involved in this CBD story, and working together, we created a really very nice herbal product based on cannabidiol, on CBD, and we tried to test it on our patients. Working together with biochemists and other clinicians, we created really very nice product. It's called Fitodenta. We have gel and mouth spray just to increase wound healing. In the beginning, we believed that maybe just one product may help, and when we started to test it and just try with our patients, we included in a study 200 of them, and we got amazing results. Honestly to say, I was really very surprised on that, because the reduction of inflammation and pain was more than 35% in comparison with regular treatment, when we prescribe just like painkillers and antibiotics. Of course, in some big cases, when we have to augment bone in sinus lift and to do a huge operations amount, we cannot avoid antibiotics. It's clear, it's not a thing. But prescribing together this CBD and antibiotics, we see also much better healing, less inflammation and less pain. And for simple implants, we see already many clinical data, a lot of publications, that we can avoid prescription of antibiotics. So that's why we stay now just with Fitodenta. And yeah, I think this is really the future, to see a patient like a holistic, like a one unit, just to think about his just general health. And with it, with some products like this, we can just increase healing and really decrease some complication rates. To talk a little bit more in details about clinical study, what we did with Fitodenta products. We had, as I said, 200 patients together with other few clinics, and we tried to see what patient feels after first week after operation, to evaluate pain, then swelling, then other inflammation markers like color, tension, and how big the swelling was. Yes, just all these things looked in detail, and using scores, we just tried to compare with traditional painkillers and antibiotics. And yeah, as I mentioned, we found that 35% of pain and inflammation was less using Fitodenta together with other medicine or only Fitodenta, and then we had small operations. Talking about trend, what trend do we have in dentistry worldwide? Yes, you know, when I remember 20 years ago, when I just graduated from my university, we were taught in very straight way. Only evidence-based proved medicine should be prescribed, only clear protocols should be used. And in the past 20 years, we clearly see that not everything what we thought is true was true or is true. Sometimes we just looked into one specific thing but forget the all holistic view of person, of patient. Not only including some physical things, but also the mental health, emotional health, because everything is connected here. And yes, in the past decade, I would say, we see a huge improvement on like natural medicine, on evaluating patient as a all body of including emotions and mood, and also the things what was not included previously. So that's why I think just trying to use some natural products, herbal products, what is today available in the market, and also what push us and moves us just to move forward and investigate and improve existing things what we have. It's also makes sense, and I think that this Fitodenta product should have a great future, and more people will start to use it as a only medicine after some minor surgeries, or just as a supplement to existing antibiotics and other serious painkillers.